the FDA, since the change in administration and obviously the appointment of Robert Kennedy Jr. to HHS, which oversees some of this, has been in quite a bit of flux. The Center for Drug Evaluation and Research, CEDA, which looks after drug approvals, that head has changed. The Center for Biologics Evaluation and Research, which looks after vaccines and gene therapies, etc., got a new head, Vinay Prasad. That head left or was fired, I don't know which way he was, and then he came back again, and now he's going again. So there's been a lot of flux. So when you get flux, and they fired, 3,500 individuals. Maybe I don't have the exact number, but something in that sort of region. This is a lot of old time knowledge that's left the agency. Some refresh is pretty good, but all of this has happened under the caretakership of Marty Makary. And to all intents and purposes, the folks I talk to say that he's a perfectly knowledgeable, wonderful man. Mm-hmm. I have friends on the buy side who say to me that he's been very good to them. And then on the other hand, we hear all these issues and some biotechs having issues, etc. So right. I wouldn't be surprised if there's something happening here.
What has Marty Makary done well? I mean, I think about from a personal point of view, he's made estrogen patches more accessible for women who are suffering through menopause, and that's something he's written about in his book as well. What has he done that will kind of serve as his legacy if he does end up leaving?
Well, I think what's been good is that he's much more available for us to hear from. Do you know what I mean? He does Twitter videos, sit downs and discusses and brings ideas and wants to make animal testing less required. He wants to get drug development timelines shortened. They've done some deals with AstraZeneca and one other pharma company, Amgen, I think, to try and reduce the time of drug development, which gives pharma companies the ability to bring drugs faster to patients. What the problem is that there's been all this upheaval and issues with not knowing exactly what to expect, having had a deal with the FDA when you go back with your data, and bringing some of these things into public conversation where it shouldn't have been done. So there's pluses and minuses here, unfortunately, and what the FDA now needs is a good solid pair of hands that just gets down to the business of looking at the safety and efficacy of drugs.
Sam, if when you talk to your pharma companies and biotech companies, is it harder to get stuff done today under this administration? Easier? About the same? Puts and takes? Kind of what's the overall view?
Yeah, I would say puts and takes. It's a perfect phrase here because it depends who you talk to. It depends whether you talk to them in public or in private. If you talk to, nobody wants to upset the agency because if you already have some trouble or some problem or some friction, why would you want to add to it? So if you look at what companies are saying publicly, everything's fine. But then companies go and say, well, we've had this drug discussion with the FDA. This was what we were told to do. We did it. And now they say no. So there's some of that going on, which, of course, is reality. So I think it all depends on who you talk to, when you talk to them, in what setting. I think that folks wouldn't mind a change here.
Before we let you go, Sam, I got to ask you about the Hantavirus that is a big issue with one of the cruise ships. We know that Gene Hackman's wife passed away from this as well. And so this is something that's kind of been percolating. But how concerned should we be about the Hantavirus?
Yeah, and 3 people have perished on the boat, which is obviously very sad. With the current knowledge that we have about these viruses, and there have been other outbreaks before 1993, there have been transmissions to humans. It's a virus that doesn't transmit that easily. It's not like COVID. They just have to breathe someone's breath in a restaurant and you catch it. This requires much closer contact, much higher duration of exposure, and quarantine is the best way to silence it. But you need a functioning CDC in the US that's on the ball, finding people who have traveled back and isolating them, and finding their contacts and isolating them. That's the best way to do it. Don't forget, though, Scarlet, viruses do have a nasty habit of mutating. Yes. So we should always have that little thing in the back of our mind that what we don't want to happen, the more you allow it to transmit to people, the more chance it gets.